Hello students, today we will discuss a very important clinical status. It is visible, spotter-like. Just tell what is it. What is this clinical status is? Look at this. What is this is called as? I'm not bothered about he has undergone major surgery, all those things, post-operative period. So what is this status called as? You have to know, you have to tell. So this is cachexia. If it is due to malignancy, it is called as malignant cachexia. But terminology cachexia denotes that it's really catabolic, nutritionally deprived, skeletonized rather than. So what are the features? What is cachexia? It is look like emaciated, languid, sallow, pale face, wrinkled skin, dry skin, loss of subcutaneous fat with the profound loss of weight. This is important. Profound loss of weight and energy. That is the word, key word, emaciated. That is also important. Emaciated, languid, profound loss of weight and energy. That is the definition of cachexia. Patient will be severely catabolic with the negative nitrogen balance. This is again important. I already told. Seen in malignancy, any GA commonly, advanced metastatic, any disease, metastatic mainly. Pancreatitis is a chronic one. Chronic metabolic illness of any nature, severe sepsis also they can be, immunosuppressive people. So all these patients it is seen mainly malignancy, pancreatitis, immunosuppressed, severely ill patients, severe sepsis. So has got very high mortality, so they die because very difficult to revive them. So what's the treatment? Assess the patient, how bad patient is, then give TPN with a central line in the neck. Total parenteral nutrition is a mandatory. And energy supplements, treating the cause, and anabolic steroids. In brief, I would discuss. So this is the different thing. So you should remember this. It's a catabolic status. So we have to switch over to the anabolic phase in this patient. It is a catabolic response. It is not good, dangerous, life-threatening. Remember. So student, this is the status you have to remember. So remember my clinical book with the videos. It shows everything clinical surgery, surgical principles with my book, and operative surgery and tissue approximation. And of course, go through my DigiNor, around 220 hours lectures are there. Everything it is covered, including clinical examination, topics, operative surgery, x-rays, instruments, pathological specimens. Everything it is covered, what is needed for student, undergraduates and postgraduates. And please go through those books and my DigiNor so that you will have a great idea about entire surgery as such. Thank you very much. Hope students you have understood the lecture very well.